So if you didn't hear me in the back, 3 out of 4 veterinarians attended Auburn University here, and there's some great credence to that fact. As Amber stated, I'm with the Department of Homeland Security, the Office of Health Affairs. I've been there since 2007. Really the genesis of the origin of the Office of Health Affairs within the Department of Homeland Security. We're the principal medical advisor to our secretary and have responsibility for all health and public health and medical matters within the department. Obviously that, given my presence, includes veterinary medicine, food and animal health issues, and agricultural production as well. My boss comes by some mornings and says, "How are we doing?" And I tell him the crops are growing, the food is safe, and the animals are healthy. And that's a measure of our success and our partners' success on a daily basis, that we're able to maintain that. Our office is truly a One Health office. We're comprised of veterinarians, physicians, PAs, environmentalists, and several other colleagues in the dental profession even that work together, and we try to think about our environment, our interaction and engagement between animal health and human health on a daily basis. So we work closely with our colleagues in the human health field on issues that are particularly germane to the zoonotic diseases. Much of what we do, the Food, Agriculture, Veterinary Defense branch, is directed by DHS responsibilities in Homeland Security Presidential Directive Number 9, Defense of the United States of Agriculture and Food. DHS, just like many other departments and agencies, have specific duties and responsibilities that have been outlined in HSPD 9, and the Office of Health Affairs is specifically charged with management oversight of those responsibilities within the Department of Homeland Security. I think there are 2 words that you have to remember when we talk about what we veterinarians do in Homeland Security, and that is partnership and collaboration. There's not any single responsibility that we have that does not involve other partners and agencies, USDA, FDA, EPA. We've worked with a wide array of different colleagues in these offices, and we always try to maintain that collegial atmosphere of trust and partnership as we go forward. So I'll touch on a few quick issues within the Department of Homeland Security, and then I'm going to turn the forum over to my colleagues. But I do want to impart a sense of some of the areas in which the department is charged with responsibilities. And of course, the first and foremost is likely the Science and Technology Directorate in the Department of Homeland Security. In 2003, they were given the responsibility for oversight and management of Plum Island, and worked closely with USDA, APHIS, and USDA ARS at Plum Island. I've often said that the nature of the relationship between DHS, USDA at Plum is truly the model for what interagency partnerships and relationships ought to be. And of course, I suspect there may be something associated with the fact that they're all trapped on the island and have to get along. So, but again, Dr. Larry Baird, a former California state veterinarian, manages the island for DHS and works closely with USDA and ARS and APHIS there. Some of the work that's come out of that partnership and out of that collaboration is the development of the first new FMD vaccine in over 60 years, the first new technology for FMD vaccine in over 60 years. And I'm sure most of you saw recently that this product was licensed by Center for Veterinary Biologics, but the Science and Technology Directorate, APHIS, ARS, worked closely in the creation of this vaccine, and it's on a human adenovirus platform, a single strain, and ultimately we hope to develop additional strains that can be added to this platform and allow us to manufacture the vaccine in this country, given the fact that the function for replication of the virus has been removed, and this particular portion of the virus can be managed on the continental U.S. Another interesting opportunity that came available through a DHS USDA partnership is the licensing of a permittee for the importation of foot and mouth disease vaccine from Argentina. TABI, the Transboundary Animal Biologics Incorporated nonprofit group at Iowa State, in close collaboration with CBB and the Science and Technology Directorate, are now a permittee for the import of foot and mouth disease vaccine should we have an outbreak that is strain specific to the quadrivalent vaccine that's held available for importation. A couple other programs within the S&T Directorate. The Office of University Programs that manages the DHS Centers of Excellence. And I suspect that the 3 food and agriculture centers of excellence are first among the many 18 or so centers of excellence that exist across the country, and those are FASD, Foreign Animal and Zoonotic Disease Center at Texas A&M, CZAD, the Center for Emerging and Zoonotic Diseases at Kansas State, and NCFPD, the National Center for Food Protection and Defense at the University of Minnesota. So again, certainly from the public health perspective, the idea of our engagement in zoonotic diseases, in food safety and food defense, the veterinarian's role in each of those areas is of prime importance. And then finally, the Office of National Labs, which has struggled, I suspect it's fair to say, with the issues surrounding NBAF, the National Bio and Agro Defense Facility in Kansas, and of course some press last week that on Friday the assessment of 2 site-specific risk assessments and a review of those left the issue in question about how NBAF comes to pass and what funding will be available for it. So other than that, I don't think there's, I think everything's up in the air at this point. It's difficult to say how this progresses. I'll talk about FEMA a little bit, and this one of the line items in HSPD 9 that DHS is actively engaged in is response to ensuring local and state response capability, and from our perspective that's in the food and agriculture arena. And we're actually working closely with FEMA right now to institute a uniform planning process for the food and ag sector across the country. It's only through that uniform planning process that you can hope to have consistent response capability at the state and local level. We're also working with NCFPD to develop a training curriculum for our agricultural response group around the country. The group in FEMA, the National Training and Education Division, has lost all of its funding for food and ag sector. So we hope to pick up the curriculum, the course curriculum that exists, put it in some organized curriculum template that will allow responders all around the country to achieve certain levels of expertise as they advance through that training curriculum. The Intelligence Analysis Group within DHS, Dr. Clifford mentioned the National Center for Medical Intelligence. We actually have a detailee from our shop at NCMI, but INA folks, we work closely with them on the similar issues that NCMI addresses in terms of existing threat around the world, outbreaks of animal diseases, crop diseases, a variety of different concerns that are registered. And we're all familiar with South Korea and Japan in the last few years, and now the new strains that have shown up in Egypt and Libya of foot and mouth disease. The Customs and Border Protection, agricultural specialists, some 2,400 agricultural specialists that are ports and borders that look for products, contraband that's attempted to be brought into countries to prevent the introduction of animal diseases or plant diseases or pests. So they're an integral part of our defense at our ports and borders for the food and agriculture sector, and of course CBP, USDA, APHIS, both veterinary services and PPQ work closely together to manage all those issues. And finally, I'll touch on NPPD, the National Protection Programs Directorate, and their Government Coordinating Council, Sector Coordinating Council within the food and ag sector that works together closely to share information associated with activities within the sector. I'm going to stop with those